be on to you, to all of you as well. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Are all of you in good shape? I hope you do. Before starting my explanation about bipolar disorder, I'll introduce myself. My name is Hety Estora. I am grade 12 student of Vocational High School number 1 Kelapa, majoring in Multimedia. This video is uploaded to meet the grade 12 English subject practice exam scores. Now, let's get into the material.
What are bipolar disorders?
Bipolar disorder is a condition in which person experience mood swings that fluctuate drastically. For example, suddenly becoming very happy from previously depressed. Another name of bipolar disorder is manic depressive disorder.
Risk factors for bipolar disorders.
There are several factors that took to increase a person's risk of developing bipolar disorder, namely, number 1, experiencing severe stress, number 2, traumatic incident, number 3, addiction to alcoholic drinks or illegal drug, number 4, have a close family history or sibling or parent of suffering from bipolar disorder.
Bipolar disorder symptoms.
There are two phases in bipolar disorder, namely the manic phase or rising and depression or falling. During the manic period, the person looks very excited, energetic, and speaks fast. Meanwhile, during the depression period, the sufferer will look sad, lethargic, and lose interest in daily activities. Based on the cycle of mood episodes, some people with bipolar disorder experience a normal state between mania and depression. Others experience rapid cycling from mania to depression or vice versa in absence of a normal period or rapid cycling. In addition, there are also people who experience mania and depression at the same time. For example, when someone feels very energetic, but at the same time, they also feel very sad and hopeless. This phenomenon is called the mixed state.
Diagnosis of bipolar disorder.
Further diagnosis of this condition is needed. A symptom of bipolar disorder with other conditions, such as thyroid disease, and the effect of alcoholism or drug addiction. Examination can be done by interviewing the family or relatives of people with bipolar disorder. Symptoms interview, such as when symptoms appear. The sufferer will be then directed to a psychiatrist or mental health specialist. The psychiatrist will do some speech, thinking, and thinking pattern experience. The psychiatrist may also ask about family history, medical history, and sleep patterns. The sufferer may also be given a questionnaire that can be filled out. When enough results are found, the psychiatrist will then classify the person according to Diagnostic and Statistical Manual of Mental Disorders.
Causes of bipolar disorder.
Some experts argue that this condition is caused by an imbalance of neurotransmitters or substances that control brain function. Not only that, there are also those who argue that bipolar disorder is related to heredity. Some of factors that are took to increase a person's risk of developing bipolar disorder are experience high levels of stress, traumatic experience, addiction to alcoholic drinks or illegal drugs, and having a close family or sibling or parent of having bipolar disorder.
Treatment of bipolar disorders.
The goal of bipolar disorder treatment is to reduce the frequency of phases of mania and depression so that the sufferer can live normally and blend in with the environment. In addition to improving lifestyle, treatment usually includes the administration of drugs combined with psychological therapy or, for example, cognitive behavioral therapy.
Bipolar disorder prevention.
Preventive steps that can be done are to reduce the effects of bipolar disorder, namely by providing therapy according to doctor recommendation.
When to see a doctor?
You should talk to your doctor if bipolar disorder exhibits any of the following things. Number 1, symptoms of a period mood that occur in the long term. Number 2, having thought of suicide. Number 3, feeling aggressive and confrontational. Number 4, difficulty sleeping within a few days. There is nothing wrong with contacting the doctor if you experience the symptoms above. In fact, proper handling can reduce the consequence of this condition. Well, that's all that can explain to all of you about bipolar disorder. Hopefully, with this explanation, all of you do not underestimate disorders that are considered minor. I'm ending. Wassalamualaikum warahmatullahi wabarakatuh. Have a good day, everyone. See you. Bye-bye.